Hello, everybody. My name is Karen Whittemore. Thank you for joining us today. I am a family nurse practitioner, for those of you who don't know me. I've been in practice for 25 years, and actually more than that. And in all of my time, I have never seen anything quite like the technology from LifeWave with the X39 patch. And today we're going to share a little bit of information about this. And first off, we have a special guest. We have Ken Ragsdale with us, and he's going to be sharing some of his experience with it before we talk about how the patch works, how you might be able to take advantage of it and use it in your own life. So Ken, welcome. How are you today?
Doing good. Can't
Good.
complain.
Good. Now, I know that you had an experience with COVID. Do you actually want to just tell us what your life was like before you used the patches?
Well, in July of 2021, I had COVID, late end of July of 2021. And before that, I was healthy, did whatever I wanted, and just a normal old guy. But in 2021, I came down with COVID and didn't know anything about the patches, didn't know anything about it. The doctors at that time wouldn't do anything for me. I was in the hospital for 3 days. I don't know what they did to me, but I came out and I was on oxygen and both of whatever they call the thing that you generate your own oxygen at home. And I was on that for several weeks. But we had some art festivals in Colorado and Denver that we needed to go to on September the 18th. And I was still on oxygen. And during this time frame, I had went to a natural grocery store and was looking for some NAC, and they were completely out. And I asked the guy that was managing that area, I said, what's going on? He said, well, the doctors recommended it. I said, which doctors? And Karen Whittemore was one of them. And so I called Karen the very next day and got an appointment, and she took care of me. And she introduced me to, or both of us, Janet and I both, to LifeWave. And she asked us to come to a meeting, and we did. And we signed up the very next day after the meeting. And that was probably around next to the last week in August is when that was. Or maybe the first, probably the last week of August. Somewhere, I don't know, first of September or something. Anyway, we ordered all the patches, but we were leaving on a Saturday to go up to Denver to go to these arts festivals. And I still had a portable oxygen concentrator, I had tanks with me and everything, and was still on oxygen. Didn't know how I was going to set up tents and do all this kind of stuff, but we were going to do it. And then the patches didn't come in, wasn't coming in time for us to leave. So I went down to UPS that morning on a Saturday morning and actually got the patches from the UPS distribution center so that we could leave that day. And I started X39 that day, and we left, and I never was on oxygen again.
That's so how soon did you come off of the oxygen once you started using the patch?
Within a day.
Wow. So I'm guessing you had an oximeter that you were monitoring yourself.
Yes.
And so what were your oxygen levels like?
When I went into the hospital, my oxygen was at 75, which was,
and if I remember correctly, didn't they want you to go on the ventilator?
Yeah.
And you refused? That's what I thought.
Which was the reason I didn't want to go to the hospital to start with, because I knew they was going to put me on a ventilator, and everything you heard was you don't come off of them. And so I just was not going to do it. And so the X39 saved me. I mean, they really did. I can't say anything else but that.
So did you noticeably feel a difference with your breathing, or you just noticed that your oxygen level had improved and that you didn't need to use the oxygen anymore? What did you notice?
Well, I can't remember that I noticed anything about my breathing or anything. I probably did, but I was constantly checking my blood oxygen level, and my blood oxygen level was just kept increasing. And so
That's awesome.
I just never used it. I took the oxygen generator with me and the oxygen tanks in the RV, and they never came out. I never used them. And
Yay.
a 2-day show in Denver, and then a week later we did a 2-day show in another 2-day show in Denver, and then drove home. So we were over there in Denver for 2 weeks, and not a problem.
And Ken, just so everybody knows, is an amazing artist. He does some wonderful woodwork, and I'm guessing that those pieces that we're seeing on the shelf in the background are some of your pieces?
Some of them, yeah.
That's awesome. And your shoulder has been a problem too. Can you kind of share a little bit about that?
Before we moved up here to Cedar City, I was diagnosed, excuse me, I was diagnosed with a torn rotator cuff. And they told me, they said, we don't operate until it gets so bad you can't stand it. And I said, that's fine with me. And they told me that I would be out of commission for six weeks a minimum, and longer than that usually. And so I couldn't stand to do that. I can't be down for that long. I'm too active, and I wouldn't do it. And so I just babied my shoulder along and, took care of it and the best I could. And it would flare up occasionally. And probably about a month ago, I noticed that it was better just because I was wearing X39s every day. But I thought, why don't I put the X39 on my shoulder where I know the tear is, and see if that helps. And I put it on there along with carnosines, and it has just done wonders. I mean, before I couldn't reach behind my neck. I couldn't reach behind my back. I had to change the way I put shirts on and jackets on and everything because I couldn't bend my shoulder that much to do it. And now I don't notice that at all.
Wonderful.
I can do whatever I want.
Yay. Yay. That's great to hear. So were you stacking the carnosine and the X39 on top of each other, or just kind of putting them next to each other? How are you patching?
I put them next to each other. I put the carnosine, put the X39 where I knew the tear was, because I had seen the scans and everything, and I knew where the tear was. And so I put the X39 right there, and then I put a carnosine on each side of the X39 patch. And then yesterday, when we was at the meeting, I learned that I should be putting EONs on there. So now I'm putting EONs on there.
Awesome. Awesome. That's so wonderful to hear. Okay. Well, my question for everybody out there is, have you been patched yet? I have been using the X39 patch now for the last 3 years. Can you imagine experiencing a level of health and vitality that you have not experienced since your youth? You elevate, you activate, you regenerate your stem cells. Imagine having no pain, sleeping through the night, having more energy, and reversing aging. That is what we are talking about today. And this is possible. This is not science fiction. This is not years in the future. This is something that is available to us right now. So as we age, our stem cells decline. The fewer the stem cells you have, the faster you age and the slower you heal. Hundreds of millions of people are experiencing symptoms of aging, just like myself. I am 57. And what I was noticing is that I would have to wake up every couple of hours, 1 to 2 hours, to get up and pee. It was ridiculous how many times I was getting up. And I couldn't sleep well through the night at all. And that affects your thinking. So it makes it so you have much foggier thinking during the day, so that it takes you a lot longer to chart and get through your patients. I also noticed that the padding under my eyes seemed like it was getting thinner, and I was getting receding hairlines, which I, of course, didn't like. But as we age, the stem cells in our body, they become less active. And by age 60, the stem cells in our body show very little activity. They become slower and release less of the growth factors that are needed to repair our body. By the time we're in our mid-70s, we are showing almost no stem cell activity at all. And that's why older people have such a difficult time healing after an injury. Now, we do have a disclaimer. LifeWave products are not intended to diagnose, treat, cure, or prevent any disease or medical condition, and you always do want to consult with a physician or qualified healthcare provider before you embark on any new treatment, regimen, product, diet, or fitness program. So that being said, this is not doing anything. It's not curing you. It's not healing you. What it is doing is it is giving your body the tools that it needs so that it can heal itself. So how the X39 works, this is like the holy grail of reverse aging. It's made of organic nanocrystals, and it elevates a peptide in your system called copper peptide. And in turn, that activates stem cells, and it's clinically proven to enhance overall health and vitality. So this is frequency medicine, and that probably the easiest way to explain frequency medicine is with the sunlight and getting vitamin D. So I used to think that when you went out in the sun was giving you vitamin D, and that's not how it works. There are frequencies in the light spectrum of the sun that when they hit your body, when they stimulate your skin, it tells your body, hey, it's time to start manufacturing vitamin D. And so you do. And this patch is working on that same principle. Our bodies constantly emit light. We are light beings. Far infrared energy. If you looked at yourselves, if we looked at each other with night goggles on, we would see that we are glowing with all this light around our body. And that light, we recognize it as heat, but it is in the frequency called far infrared light. And it bounces off of these crystals, gets infused with this frequency, and goes back into our system, telling our bodies to start manufacturing more copper peptide. And that in turn gets the stem cells going. So that being said, just the copper peptide alone has amazing benefits. So this is what the National Institute of Health has to say on their website. Copper peptide stimulates blood vessel and nerve outgrowth and increases collagen and elastin for visible anti-aging. Copper peptide's ability to improve tissue repair has been demonstrated for skin, lung connective tissue, bony tissue, liver, and stomach lining. Copper peptide has also been found to possess powerful cell productive actions such as multiple anti-cancer activities and anti-inflammatory actions, as well as having anti-anxiety, anti-pain, and anti-aggression activities. And their site goes on and on with more things, but these are just a few of the top of the list. But notice the lung connective tissue getting that extra need of repair with copper peptide. I recently read a study where copper peptide was shown as one of the best treatments for COPD. So now we're not saying this is a treatment or anything, but it is interesting to note Ken's experience using the X39 and how quickly he was able to come off of the oxygen. So who came up with this? Our inventor, founder, and CEO of LifeWave is David Schmidt. He has over 130 US patents, and over 70 of them are just in regenerative science alone. He is a scientist and inventor and a two-time recipient of the Advanced Technology Award from the International Hall of Fame. So that is pretty impressive. And how did LifeWave first begin? Well, he was actually working on a project for the military, trying to help Navy SEALs to be able to stay awake for 30 hours while in a mini sub without having to use caffeine or other type of stimulants. They wanted nothing unhealthy entering the body. And so he came up with the Energy Enhancer patch. That was the company's first prototype. And he actually decided to bring it to market so that everybody could get access to it. And that's why he came up with LifeWave and set it up as a direct sales marketing program so that he could get access to people all around the world. And I think because the wisdom in that is that we are a global company now, rather than if he would have just entered into Walgreens. I think Walgreens had offered him a contract to put it in their store. There would be very few people that have heard of it. And this is still a new thing, and people wouldn't have understood exactly how to use it and the great benefits of it. So this company has been in business for 20 years. They have over 80 research and clinical studies, multiple patents protecting things. There are independent researchers and universities, medical and scientific experts who have studied this. This is one of the studies that I really like here in this bottom left-hand corner. This is a brain scan of a 77-year-old. Now, this female, we just got done saying a little bit earlier that by our 70s, we have very little to no stem cell activity at all. So that's why this is so impressive. You can see on the right side of that little panel, the higher the microvoltage in your brain, the more red. So in this first reading, this 77-year-old female, before starting the X39, had a lot of red, so very overactive, probably an anxious person, had a lot going on in her brain. After just 3 weeks of wearing the X39 every day, you can see how much calmer that brain looks. And after 6 weeks, it maintains that calmness. So this is an amazing thing, especially when you think that you have very little to start with, and yet we were able to get that activated and generated with use of the X39, stimulating, activating her copper peptide, and then activating those stem cells, getting them going. You can see on the right side, this is the patent that they put together for the X39. You don't get a patent unless you can prove what it is that you're saying it does. And in this patent, it says that it elevates copper peptide for the activation of stem cells. We have studies that show that it activates within just 24 hours, and within 77 days, your copper peptide is much higher, much more elevated. So we have the scientific studies that show that. So what are some of the benefits of the X39 technology? Well, there are people who have experienced rapid pain relief, reductions in inflammation. That is a big one because inflammation is at the core of so many disease processes. So being able to reduce inflammation, you're able to help so many other aspects of our health. And that happens within just 24 hours. We have studies that have shown that. It supports wound healing. Energy and vitality can increase, mental clarity increases. You can have enhanced sports performance, faster recovery and from exercise, and improved skin appearance. So Ken, did you notice, you may not have had the rapid pain relief with your shoulder, but did you notice over time how gradually you were having improvements, or what did you notice?
Yeah, I noticed that it wasn't bothering me like it had in the past. And that's when I decided, if it's doing that, why not put it on the location of the pain and see if that doesn't help too.
Nice.
Something to mention is that you mentioned your receding hairline.
Yeah.
One of the things I noticed when I came out of COVID is my hair was completely white and there wasn't much of it left.
Oh.
And I had a full head of hair before. And when I started taking X39s, my brown came back to my hair and it's growing like crazy.
That's awesome. Yeah, I noticed that. Yeah, my hair has filled in from where it was receding. And I noticed that with my mother too. Her hair was really white when she had come out of the hospital a couple of years ago, before she was really heavily patching. And her hair has gotten darker too. A lot of people have noticed that when they've looked at her before pictures and after pictures. So that's cool that you've noticed the same thing with more color coming in.
Yeah, because with the white hair, I was looking like I was 76 years old. And
yeah, it makes you look older. We don't need that. We want to have a little color in there. So what can you experience? What do you experience in the body? What can you expect? Well, within the first few days, 4,000 genes to begin to reset, and that's a third of the body's genome. Within 6 weeks, the brain becomes more balanced. There's decreased symptoms of PTSD, anxiety, and depression. So that goes back to the pictures of the brain, the scan of the brain that we saw the 77-year-old female. Within 3 months, your collagen is increased, so there's decreases in wrinkles, hair growth increases in structural integrity of both your skeletal and muscular systems. So yeah, I started noticing probably about 3 months into it that I was getting more plumpness under my eyes again. My sleep got so much better. And yeah, the recession started filling in. But these were just some of well, the sleep was an inside thing, but the other things were outside things. But you can imagine what's going on the inside. And that can be hard for some people, because some people feel like they're wearing the patch and they really don't feel any different and wonder, well, why am I using this? How do I know it's really doing anything? So that's why I really like this next study. Within 6 months, the heart reverses in age. So they took 15 people and they had them wear the X39 patch every day for 6 months. And 14 out of those 15 people had a reversal of their vascular health, their vascular age, by 8 years, by an average of 8 years. That is incredible. I mean, cardiovascular disease is still the #1 killer out there. So anything that we can do to help our insides like that, and to help our heart, help our systems, that is wonderful. So even though I know I don't feel something every day, I know that it's making all these wonderful repairs. I've seen enough of the studies that I know it's doing important things for me, and I don't want to stop doing it. I want to give my body every advantage it can, every advantage it needs. So David Schmidt made this quote: "It's not anti-aging, it's age reversing," because that's what it's doing. If you can reverse your vascular age by 8 years, that's reversing aging. That's not just stopping the progression. And that's what most of our medications do, like our statin drugs and things like this, that it can help stop some of the progression or slow it down, but it's not really reversing it. And so having a tool like this in our toolkit, that is a blessing. So where can you go to find out more? Well, we do have a website. It's called yourteaminmotion.com. It has testimonials on there. There's information on all the different patches, how to use them. There's business information. So if you have any questions, you can go check that out. You might want to write down the name of this website. It's called yourteaminmotion.com. And that's basically all I have to present with you today, to share. And I want to thank you all so much for joining me. And thank you, Ken, for sharing your story and your experiences. We love to hear it, because we always learn so much. So thank you.
Thank you.
And thank you, everyone.